Hi, this is Dr. Peter Balogh to talk to you about some of the pitfalls of wearing dentures. Although dentures may seem like a great option, especially if you've got very few teeth or you've got teeth that aren't really falling apart, your first choice or your first thought may be to have all your teeth removed and get some dentures put in place. But I just want to make you just to think twice before you make that decision, because dentures, although you take some teeth out and you can get some dentures in place and they'll seem wonderful and they'll see nice and straight, you got nice color and everything else, they're not a great replacement for natural teeth. In fact, they're a very poor replacement for a few reasons. Number one, here's an example of an upper denture. It typically covers the roof of the mouth, so therefore when you do that you lose the sense of taste and texture of food. You have some minor salivary glands on the roof of your mouth. You really do, it does affect your taste of your foods. And no matter what, even the best fitting denture tends to get a bit of food underneath, so you're getting something underneath. It's like walking in the beach and you're getting sand in your shoes. It just can be really annoying. So it's not the greatest. Although they can look really nice, they're designed mainly for chewing with the back teeth. They're not designed, or they're very rarely, I should say, it's not so much that they're not designed, but very rarely can you bite in the front with these teeth. What holds them in place is a little bit of suction and just a press fit against the gums. And if you bite with the front, then they tend to tip and they come down. So with few exceptions, most people cannot bite into something with the front teeth. There are some people, however, who are really fortunate with dentures. They can bite into things with the front teeth and they don't drop down. Most people, however, when they bite with the front, they drop down and they fall out and they come loose. The other thing is you cannot chew and eat as forcefully with dentures as you can with your natural teeth. Natural teeth, we can bite with about 200 to 300 pounds per square inch. We can clench with 500 to 1,000 pounds per square inch quite forcefully. However, with dentures, and they've shown this in studies, the biting pressure is typically less than 50 and actually quite commonly 25 pounds per square inch. And the longer we've had our teeth, our biting force is decreased for a number of reasons, which I won't go into right now, but it's decreased for a number of reasons. And in some people, the biting force is only about 5 pounds per square inch. So you can imagine if you've got somebody who's trying to eat a meal with a denture and someone who's eating a meal with natural teeth, it's going to take them a lot longer to eat their food with a denture than it is with natural teeth, because they just cannot cut through the food very well. They can't mill their food very well, and of course it's not as comfortable for the reason that this denture is sitting on the gums and it's pressing into the gums. It's 10 times or 100 times worse on the lower arch than it is on the upper, and the reason is here's a lower denture and you can see there's no part in the middle there, and that's as there is on the upper, and that's because we need room for the tongue. So there's a much smaller surface area with this lower denture than there is with the upper. And how dentures stay in place is by kind of like a snowshoe effect. It spreads out the pressure over as wide an area as possible. And on the upper, you've got the hard palate, the roof of the mouth, which is nice and firm, thick gum tissue, doesn't change size or shape over the years, and is very stable and good support for an upper denture. You don't have that on the bottom. And also what you do have on the bottom is a tongue that every time we're talking, eating, swallowing, the tongue's moving around and it's knocking these teeth around. So in essence, if you're comparing top and lower dentures, upper dentures can be reasonably okay, but still a poor comparison for natural teeth. Lowers are typically horrible. So bottom line is if you're going to lose some teeth, and you're considering dentures, especially on the bottom, try to hang on to at least a few teeth on the bottom to help stabilize your lower denture. I've got one patient right now I can think of who came in with maybe less than half a dozen teeth. They were all going to go anyways within about a year and a half, and slowly she's been losing teeth left, right, and center. I finally got to the point that she got fed up, says, I just want to take them all out. We could have left one or two in the bottom for a short period of time, probably not much longer than a year or two, but it might have made that transition going from some teeth to full denture a little bit easier. However, she decided, no, I just want to get them all out, despite my better judgment. So that's what we did. Now she's really struggling with these teeth because they're just moving all around, and despite all our best efforts to try to stabilize them, they just don't staying in place. So there's a lot of other things I could talk about, but I just wanted to just impress upon you, if you're considering having to have teeth out and you're considering dentures, do what you can, or talk to your dentist to see what they can do to try to even preserve a few teeth just to stabilize your dentures, and especially on the bottom. So hopefully that helps. I hope it's just a little tidbit of information, but I hope that helps with your decision making. If you have any other questions, you can always write to us at www.vccid.com. Thank you.